Induced. Definition: Heparin-induced thrombocytopenia is the development of thrombocytopenia at low platelet count due to the administration of various forms of heparin and anticoagulant. Signs and symptoms. Heparin may be used for both prevention and the treatment of thrombosis. It exists in two main forms: an unfractionated form that can be injected under the skin or through an intravenous infusion, and a low molecular weight form that is generally given subcutaneously. Signs and symptoms. In heat, the platelet count of the blood falls below the normal range, a condition called thrombocytopenia. However, it is generally not low enough to lead to an increased risk of bleeding. Mechanism. Heparin occurs naturally in the human body, but the development of heat antibody subjects heparin sulfate may act as a happen and thus be targeted by the immune systems. Mechanism. These antibodies are usually of a IgG class, and their development usually takes about 5 days. However, those who have been exposed to heparin in the last 5 months may still have circulating hemoglobin G. Diagnosis. Heat may be solved if blood tests show a failing platelet count in someone receiving heparin, even if the heparin has already been discontinued.
Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition, page 570, Rapid Review. What is idiopathic thrombocytopenic purpura? Idiopathic thrombocytopenic purpura is a bleeding disorder in which the immune system destroys the platelets. This condition is also sometimes referred to as immune thrombocytopenic purpura. What lab or diagnostic?
Treatment. Given the fight and heat predisposes strongly to new episodes of thrombosis, it is not sufficient to simply discontinue the heparin administration. Treatment. Generally, an alternative anticoagulant is needed to suppress a generation of antibodies stops and the platelet count recovers. Epidemiology. The exact number of cases of heat in the general population is unknown. What is known is that women receiving heparin after recent surgical procedure, particularly cardiothoracic surgery, have a heated risk, while the risk is very low in women just before and after giving birth. History. While heparin was introduced for clinical use in the late 1930s, new thrombosis in the people treated with heparin as not described until 1957, when vascular surgeons reported the association.
Idiopathic thrombocytopenic purpura is also known as ITP. Idiopathic thrombocytopenic purpura is also known as ITP, a much easier term to express. It's also known as immune thrombocytopenic purpura. So ITP is classified as an autoimmune disease with symptoms of low platelet counts.
Thank you.